Right now, Ceres community workers in the Western Cape are fed up with the health system in their area. They say they're suffering due to a shortage of doctors, which results in patients not getting the help they need. They have this morning been protesting outside Bella Vista Clinic, vowing to continue until their plight is taken seriously. eNCA's reporter Monique Mortlock is covering that story for us, and she joins us now live. Monique, the healthcare workers in South Africa have always said that COVID-19 has exacerbated the fact that they were already in shortage, and now you find community members also helping them in asking government for assistance.
Yes, and we have received a response from the health department. They responded quite quickly in those various concerns that I mentioned to them that the community of Ceres raised. The health department said that they are addressing many of these issues and the challenges, and that the issue especially of understaffing is an internal matter that they are dealing with, and they are going to be having further engagements with community members there in Ceres. But to chat to us more about the overall challenge on staff members in the health system, I'm speaking to Health MEC Noma Frenchumbombo. I'm catching up with her here at the Stickland Hospital, where she's been engaging with the staff members here and with members of the media, chatting about the pressure on mental health facilities. And MEC, you were taking a walk around the facility, looking at here where we are, this detox facility. Tell us about the challenges, especially due to the pandemic, how the pandemic has worsened the challenges for mental health facilities.
Yes, indeed. With the COVID, it has affected most other non-COVID services, where they have to be left behind whilst we are prioritizing the pandemic. Chronic cases from diabetes, hypertension, where now people have to be provided with the packages of their medicines, and they were unable to come as often as they used to be, especially for the consultation. With the mental health, unfortunately, especially during the lockdown, we saw the figures where even some of our patients were not even coming back, even after they've been discharged. Like in Stickland, I think there was an 18% or so of the people who didn't come back, which has been affecting everyone. And then unfortunately, also in the primary healthcare services, where even those who have been discharged, but probably they will need to come to be assessed. It was also challenging. That's why for us, we are saying that let's recover specifically some of those non-COVID health services that were left out, like the backlog on the surgeries, the mental health. Was not only about illnesses or the person being mentally ill, but the issue of the community mental well-being that has been affected by the COVID. We have got people who have lost many families. You cannot expect that person to be mentally well. We have got businesses who have got lost their income. We cannot expect that person to be well. So that's why for us our approach is about health is everyone's business. Let's also look at the psychosocial aspect of it, working with other departments and using focusing throughout the life course, which is from the unborn child to the oldest. That's why we are committing in additional to the funding, costing that we already been implementing on the mental health space. We are adding 30 million additional budget, which also will be able to cover some of the mental health issues that are affecting at the level 1 district hospitals, like the Ceres hospital, where you'll find that mental patients now are coming back, or others that were not diagnosed, they are coming and they are mingling with the other patients, which is okay, but you need to provide some space for them to be able to be assessed, especially for the 72 hours. We are adding more for the staff, especially for the psychologists at the primary healthcare level. Because there are many of the patients who have been supposed to have been referred to the psychiatric hospitals like Stickland, but because they are full, and then those patients they ended up, for example, staying there at the district hospitals. So there are many of those, but now here we are in the detox center, which is part of the holistic approach on managing substance abuse. Because what we have seen in our district hospitals is about, especially the young ones who are presenting with a psychosis, which is mentally unwell, but we find that the contributing factors is mostly substance abuse and alcohol. So how do we ensure that we work with other departments? We also work with the communities and also with our staff in regard to that aspect.
And just lastly, MEC, from what we saw this morning in the Witzenberg region, many problems arising there. Community members unhappy about long lines outside clinics. They say there are not enough doctors, waiting periods of up to 3 to 4 days. Is this also something, when looking at rural communities and the understaffing there and the pressure on healthcare workers there, I mean, that falls under the whole mental health care aspect as well. How is the department approaching issues like that?
Yes, indeed. I was there, I think it was 3 or 4 weeks ago in Witzenberg, at the Ceres hospital, which is part of the improvement plan, is about adding more beds, converting the old CDC, which was used for the COVID patients, noting that some of the beds, because of the COVID, we have to add beds for the COVID. But now that at least we are out of the waves, and also our lessons learned is about whatever happens, there shouldn't be as many services that ended up being closed just because we're prioritizing the COVID. It shouldn't be like this, actually, because there might be other illness or the other pandemic. How it's going to be? Are you going to be closing everything? So it's now that patients and also some other people are coming back, clients are coming back, or others are starting, because in Witzenberg, for example, it's an agri environment where there are many of the seasonal workers coming in and out. But it's about now where we find that people can feel the pressure, because now they're additional. Noting, when I was speaking about the mental well-being, it also affects the staff. It's not only about the communities. We have lost about 200 of our staff members out of 21,000 deaths from the COVID. So they are also affected, similar even with their families. So whilst we try as much as we can to bring more of the services, we have to bring also more of the staffing under the kind of the conditions. So with the Ceres hospital, taking note that there used to be a private hospital there in that area that also got closed. So it means that now we have got additional requirements that we need to meet so that to service everyone. So already we are putting more money, converting additional more beds, doing the step down, which is because some people might be coming as far, because it's farming communities, they might not be able to be released, to be discharged as quickly as they can going back home, although they might be ready to go to the hospital. But you have to create a step down, which is an intermediate beds, where they could be able to wait whilst at least they are recuperating, is part of it. And we've also beefed up more of the EMS and training more community members as part of the emergency first aid responders to that effect. And also we have added, because of the issue about the petitioning and also for the protesting, we have made sure that even those who are protesting, they form part of the structures so that they can be decision makers within as part of the clinic committees, as the hospital boards. And they've been also engaging the staff there, Dr. Titus, who's the medical manager for the part of that, noting it's not only the Witzenberg. The world pressures are everywhere. Last time it was the Khayelitsha, and also 3 weeks back I was in the Central Karoo, where the Beaufort West Hospital, which also absorbed many of the accidents happening in the N1, they were sharing the similar kind of a situation. Unfortunately, with the budgets that we have, with the money that we receive from the National Treasury, which actually is going to be reduced by over 2 billion in the next coming 2 years, each and every year. So at least for now, we are doing as much as we can, where we must make sure we give all this information to the people. The socio-economic factors, the unemployment, with everything that has happened now in Khayelitsha, Manenberg, related to the crime, we are the ones who step forward and say that this is the kind of a data that we have. Can you please make sure that you make use of it so that to prevent this? Unless it is the tap is closed somewhere, which is from the socio-economic factors, most of these will always come to us. And as yet, now we have to keep on mopping the floor.
Thank you very much. Thank you. That was Western Cape Health MEC Noma French-Mbombo, and we certainly hope that some of those measures that she mentioned, especially in the Witzenberg region, that it will bear fruit and make those community members that she was mentioning a bit more satisfied with the services.
All right, Monique Mortlock, let's leave it there for now.